didn't know this, but you have cataracts. I guess everybody has cataracts, right?
They do.
Well, this is Dr. Robert McCulloch with Horizon Eye Specialist and LASIK Center, but some people have cataracts that actually blurs their vision and others don't. Is that right?
You're absolutely right. If we live long enough, we're going to get cataracts. Everybody does. It's kind of inevitable. The eye's like a camera, and at some point we drop our cameras, we break the lens in the camera, and we get cataracts.
Hey, that's a great analogy. I really understand what that is. But why is it that some people need to have surgery in order to correct that, and others don't?
The cataracts are progressive. They start at some point, they get worse and worse throughout life, and at some point they just need fixing.
All right, well, let's talk about what you guys do, and that's, I mean, LASIK. I've always heard of LASIK surgery to correct my vision because I couldn't see that far, but you're using LASIK to correct cataracts.
You know, a lot of people think LASIK surgery and cataract surgery are the same things. You got to think about it this way. LASIK surgery corrects nearsightedness, farsightedness, and astigmatism. It's kind of like this. If you were looking through your shower and it was frosted and you put a telescope on the other side of that frosted glass, you still can't see. Well, LASIK's fixing the telescope, but it doesn't fix the frosted glass. Cataracts are like looking through frosted glass.
Okay, so how is what you guys do different than typical cataract surgery?
Well, for over 30 years, Horizon Eye Specialist has been doing cataract surgery. In typical surgery, we use a vacuum system, and that little vacuum system has a little probe on the end that looks like a blender, and we break up the cataract and vacuum it through a really small incision. But now we have new surgery, and the new surgery uses a laser. And the laser softens the cataract, it makes all the incisions, and it does it automatically. It takes the doctor out of the equation.
Wow, that's not good for job security for you, is it?
That's okay. When I get my cataracts, I want somebody who has a laser to fix mine.
Now here's what I find fascinating. So shall I assume then, because of the technology that you're using, that more people are actually candidates?
Because the lasers...
Because it's less invasive, I guess.
You hit it on the head. Why is laser better than the old technique? It's safer. And because it's safer, it lowers the risk. If we lower the risk, certainly more people can have cataract surgery earlier and don't have to wait till they go blind. And
is it true that actually after having a cataract surgery that you can see better than you've ever seen before?
Well, with modern technology, not only do we remove the cataract, we're going to put a new lens back in the eye. Think of your eye like a camera. You break your lens. We've got to take the broken lens out. We're going to put a new one in. Camera lenses come all sorts. Wide angle, zoom lenses, far range, close range. We can do the same with modern implants. They're called premium implants or premium IOLs. And these premium IOLs, some correct both your distance and close vision, some correct your far, some correct your astigmatism. We have all types, all different lenses to fit people's needs. So modern cataract surgery, we're not only fixing the cataract, we're making you see better without your glasses.
Oh my gosh, that is truly amazing. And the downtime?
You're going to need about a day off from surgery, after surgery, and pretty much most of our patients are seeing close to 20/20 the next morning.
Well, next time we speak with them, we're going to talk about those premium lenses, which is really fascinating stuff. You'll be very interested to hear about that. Horizon Eye Specialist and LASIK Center, they're located at 18325 North Allied Way, Suite 100. That's in Phoenix, and you can give them a call for more information, 602-467-4966, or you can visit their website at horizonlaservision.com.
I have some good news and I have some bad news. The bad news is, if you don't have cataracts, eventually you're going to get them. But the good news is that Dr. Robert McCulloch can fix them for you. I'm at the Horizon Eye Specialist and LASIK Center, and I'm so fascinated learning about the new technology that you guys offer. First of all, let's talk about what really is a cataract. What does that mean?
Well, the cataract, when we're 16, we can focus through our glasses. Maybe we don't even need glasses, but we focus because we have a lens. Just like a camera has a lens, you have to focus it. That lens eventually gets where it doesn't work, it doesn't focus, we start needing bifocals, and at some point that lens doesn't not only not work, it's cloudy. And we have to remove the cloudy lens and put a new lens back in so we can see.
Now, I always associate this with old people, like, you know, really old. At what age, generally, are we expecting to see some changes?
You know, we're living here in Arizona. We're exposed to a lot of ultraviolet light, and at some point, our natural lenses start getting cloudy. They generally start clouding in our 50s. They get worse and worse by 60s, and usually we start noticing problems in our 60s. And commonly by our 70s, we're having removed. But cataracts come at all ages. I've done children,
Wow.
30-year-olds, 40-year-olds, it doesn't matter. We all get these.
Okay, so let's talk about the new technology that you guys offer. Now, in the old days, how would you remove a cataract?
Well, old days is a relative term. I've literally done 24,000 cataracts.
Oh my goodness.
Through techniques that are very good. And the technique basically meant making an incision into the eye. It's a small incision. A little probe goes inside the eye. It's got a little blender on the end. It breaks up the cataract, vacuums the pieces out. And then we put through the same incision a little implant, and that would go inside the eye, and that was cataract surgery. But now I have a laser to do this. And the laser makes the incisions, the laser softens the cataract and makes it much, much more automated and frankly less risky.
Okay, so then if you're using a laser, then how do you get the lens in? Are you still doing that? Well, you have to.
We still have to put a lens back in. Think of a camera. If you took the lens out of a camera, there's no focusing. You've got to put a lens back in. So through the same microincision created by the laser, we put the implant back in.
So how do you know what type of lens to put in somebody?
This is the challenge. There are all sorts of lenses. Camera lenses come in wide-angle lenses, zoom lenses, long-range lens, short-range. And you have to have a lens kind of based on people's lifestyle needs, the power of their eye. There's just literally thousands and thousands of choices. They basically come in a couple categories. They're the standard lenses, and those are for people who don't really care about wearing glasses after surgery. And then there's premium lenses that can correct both your distance and close vision and allow you to be free of glasses.
So you're saying that maybe someone who's worn glasses all their life, developed cataract, that you do the LASIK surgery, or the laser surgery, and they don't have to wear glasses ever again?
Well, the real important thing we have to do is not only decide what type of lens, we have to get the power of the lens to be perfect. I want you to think about this. If you were trying to measure how deep the Grand Canyon was, and you had a laser rangefinder, you could shoot it down to the bottom of the Colorado River, bounce it back up, and you'd know exactly how deep the Grand Canyon was. But if you had cloud cover come over and you couldn't see the bottom of the Grand Canyon, how could you measure how deep that Grand Canyon is? Now, we must measure how long the eye is. We have to get precise measurements. And we get around this by new technology called Aura. And the Aura technology, literally, once the cataract's removed, we measure the eye right during surgery. We have thousands of implants we can then pick from off the shelves and put the right implant in to get the power as correct as possible. This is the new technology that makes things so much better.
It is absolutely fascinating, Dr. McCulloch. Thank you so much for sharing that information. Now you want to know more about Horizon Eye Specialist and LASIK Center.
Well, let me tell you, they are located at 18325 North Allied Way. That's Suite 100. That is in Phoenix, by the way. Big sign on the building. You can't miss it. Horizon Eye Specialist and LASIK Center. 602-467-4966. They also have a website, horizonlaservision.com.